Hi everyone, how are you? Welcome to another question and answer session. This is the physiology portion of MRCS exam. Here, this is the question. A 72 years old woman is admitted to the acute surgical unit with profuse vomiting. Admission blood shows the followings, in which sodium 131 millimole per liter, potassium ion concentration 2.2 millimole per liter, urea 3.1 millimole per liter, creatinine 56 micromole per liter, glucose 4.3 millimole per liter. So we have to find out which of the following ECG feature is most likely to be seen. So we have to find see the ECG and the presenting feature on the ECG. But here, first of all, in the question, we can see the different ion concentration. First of all, sodium, which is 131, which is not very low. The normal range is 135 to 145, so there is little low, and it will be corrected only by infusing the sodium chloride. But in case of potassium, here we can see it is the 2.2 millimole per liter, which is very low, and we know the very slight decrease or increase of the potassium, it affects on heart. It has a greater effect on the heart, and other options are, they are relatively constant. So here the potassium level is decreased, so we have to find out the feature of the decreased potassium ion concentration or on the ECG. Here the options are short PR interval, short QT interval, flattened P wave, J wave, and E wave. So we have to find out one of the options, which is the clinical feature of the hypokalemia. So here, first of all, in this condition, we can see increased potassium ion condition. There are different present the different ECG feature. First of all, in the second picture here, you can see the P wave is no P wave. That means in case of hyperkalemia, there is no P wave. That means the P wave absent in case of hyperkalemia. Then QRS widens. So in this condition, QRS is increased in case of high potassium level. And also here we can see the peaked T wave, tall peak T wave. So P wave absent, tall peaked T wave, wide QRS complex. These are the feature of increased potassium ion concentration or hyperkalemia. And in case of decreased potassium concentration, then that means in case of the hypokalemia, there will be different feature among them. Here we can see the flat T wave. Here we can see this is T wave flat and presence of the U wave. So these two are the most important. And in case of extreme condition, here we can see prominent U wave, prominent U wave. So this point is very important. Prominent U wave, it is the main clinical feature. Sorry, it is the main ECG feature of the decreased potassium ion concentration or in case of hypokalemia. So here we can see the hypokalemia, the most important ECG feature in case of hypokalemia, it is the prominent U wave. Here we can see this is the U wave. So in case of hypokalemia, there is the prominent U wave, then ST depression. Here we can see this is the ST segment. There is the, this is the ST segment. So ST segment decreases. Here we can see this is the ST segment depression, and T wave inversion. Normally T wave is upward, but in this condition T wave will be depression. So here this is the ECG feature of the hypokalemia. First of all, this is the prominent U wave or present of the U wave. So this point should not be forgot, that the U wave, it is clinical it is the ECG feature of the hypokalemia. Then small or absent T wave, occasionally inversion. So this point also important, that the T wave, it usually inversion, but in earlier phase it is small or absent, and in later phase this will be inversion. So first of all, U wave present or U wave appears, then a small or absent T wave. Then prolonged PR interval, this also another important feature of the hypokalemia. In this condition, PR interval will be increased. So PR interval will be increases. Then ST depression, ST segment will be depression. and long QT interval, long QT interval. So here it is now clear that all interval will be increases. Two important interval in case of hypokalemia: one is the QT interval, another one is PR interval. So both interval increase in case of hypokalemia. So this point is very, very important, that the hypokalemia causes increase interval of the ECG tracing. So in short, again, as these clinical features are very, very important, we should start from very beginning. So again, in short, U wave appears. So it is very, very important feature of the hypokalemia. Then a small or absent T wave and occasionally inversion. So T wave will be a small or absent, or it will be inversion. Then prolonged PR interval, that means all interval will be increased in case of hypokalemia, and all other feature will be decreases. Then here we can see ST depression, ST segment depression. Then long QT interval. So the interval will be increases, all the interval will be increases, segment and wave will be decrease or absent, and appearance of the U wave. So now it is clear that which is the ECG feature most likely seen. That means in case of the hypokalemia, that means when decreased potassium, what will be the ECG feature. So short PR interval, it is not true, because all the interval will increase in case of hypokalemia. So increase interval, short interval, it is not the short PR interval, because it is the long PR interval. Then QT interval, the interval will be increased in case of the hypokalemia. Then flattened P wave, actually in case of the hypokalemia, P wave is absent. P wave is absent in case of the hypokalemia. J wave not present here. J wave in the other part of the lesson, and U wave, it is the true option. So it is now clear that in case of the hypokalemia, there will be appearance of the U wave, interval will be increased. That means the PR interval, QT interval will be increased, and all the segment and the wave, they will be reduced. That means the P wave, it is the absent, ST segmentation depression. So it is all about the ECG feature of the hypokalemia. Thank you all.